hello everyone. My name is Claudia Martinez and I'm research manager here at Reform. I'm very pleased to be chairing the next session. So today we've talked a lot about putting the patient in the middle, thinking about the patient first when it comes to health tech design. And this session is specifically about that. So actually understanding how technology is shaping people's lives and how it's actually impacting on their experiences of care. And I am delighted to welcome on stage our speaker, Liz O'Riordan, who will share her story as a medical professional and a patient. So Liz is a breast surgeon who was diagnosed with breast cancer in 2015 and will tell us more about her journey. Thank you.
Thank you very much, and thank you for having me. My role in digital healthcare is working for a company called Chiron, who have developed AI deep learning techniques to help computers read mammograms. And why is that important? There's a 50% shortage of breast radiologists in the UK. Every screening mammogram has to be read by 2 of them, and 20% of those we have will retire in the next 5 years. There's a huge problem when it comes to breast screening. And they asked me if I could come on board as a patient and public advocate. Why would you choose me? Well, at the age of 40, as a consultant breast surgeon, I was diagnosed with stage 3 breast cancer, chemo, radiotherapy, and mastectomy. I then had a local recurrence last year. I know what doctors don't know, and I know what patients need. But why do Chiron need me? The Topol review that said anyone developing digital healthcare products should have patients involved from the very beginning at every step of the way. And Chiron did that by bringing me on board. And it's really important. If you're developing healthcare products to help patients, but you've never had that illness yourself, you've never talked to patients, how do you know what we need? I did some work with a company called Medopad, who've developed an app to help you keep track of symptoms during chemo. And one of their symptoms was constipation. And I said, what's constipation? And I bet if I asked every one of you in the room, I'd get 2 or 3 different answers. For some people, going once a week is constipation. But if you have IBS, you may go 8 times a day. So once a day is normal. If you're not a patient, you don't understand what we need. My role is to support, help, and guide them. I don't work for them, I work with them to hold them to account, to make sure they are representing the patient body. So what is AI? How do you explain what it is to people? My role is to help sell it to the general public. So I started off by asking 2 women who've had 20 years of mammograms, my mum and my mother-in-law, and I explained what Chiron were trying to do. And my mum said, I don't trust computers, they're scary, what happens when they get it wrong? My mother-in-law said, what happens to all the doctors who lose their jobs? Now, they're 2 extremes of opinion, but they're things you have to take into account. So what is AI? I asked Twitter. Now, some people got it, but most of the responses were Skynet from Terminator, robots taking over the world, machines killing people is what AI is, dispassionate decisions. There's a lot of scariness out there about AI. They don't get it. For me, AI is these 2 yellow tablets called letrozole. They are aromatase inhibitors that I take every day to stop my cancer coming back. That's what AI means to me. You ask a farmer, they'll give you something different. Artificial insemination. You may be very, very savvy with the terms you're throwing about, but do the public actually know what they are? There's a very interesting piece in the Times. So, artificial intelligence is like teenage sex. Everyone talks about it, no one really knows how to do it. Everyone thinks everyone else is doing it, everyone claims they're doing it. And there is bad AI out there, Babylon. It's awful, it's dangerous. One of my friends on Twitter, Dr. Murphy, just put in 60-year-old with a breast lump, no other symptoms. It asked you 3 times if you were pregnant and breastfeeding, this 60-year-old woman with a breast lump, and the main diagnosis was osteoporosis. That's the AI in deep learning. You have a breast lump, so your bones are thinning. And breast cancer, which to me is the first symptom in anyone with a breast lump over 50, was maybe not very likely. They said the public don't like hearing they might have cancer, so we put it down the bottom of the list so as not to scare them. That, to me, isn't helping people. So, back to AI. How do you explain it? I thought I knew what AI is, but when it comes to explaining deep learning, if you can't make a 5-year-old understand, you're getting it wrong. It's kind of pattern recognition, we know that, and you get better and better in time, like learning how to play chess. But here's an example. How do you know the difference between a cat and a dog? You just know they're different, but both have 4 legs, both have 2 ears, both have a tail. Is this a cat or a dog? Is this a cat or a dog? How do you know? You just know from pattern recognition, from being told, and that's how computers learn. A doctor can read 200 mammograms in a day if they do 2 sessions a day, and you're nowhere near as accurate as you are at the end as you are at the beginning. A computer can read 200,000 mammograms in a day. That's 4 years' work in a day, and they get better and better and better, and they're more accurate. And this is how you can tell the public that computers can be safe. I'm using AI. Because of severe chronic pain from my surgery and radiotherapy, I didn't realize, but if you have chronic pain, you ignore that side of your body. You ignore the left-hand side because the brain stops working, which isn't great when I'm a breast surgeon doing left and right surgeries. And there are apps to help train you. They've got hands and knees and shoulders, and you should be able to tell within seconds whether that's a right or a left hand. Put your hands up if you know what it is. So not many, taking time. Here's another one. Put your hand up the minute you know whether this is a right or a left hand. Now, most of you have had to do that without doing this. I have to, because I can't work out whether it's right or left, but you can train yourself to get better, to train your brain to know what's going on. It's just other ways of explaining to the public what AI is. Now, the problem is when Chiron first started, they were using patient groups in hospitals, and most patients have a grudge, they have a complaint to approve. It's a bit like TripAdvisor. Most people we treat are happy and can't be bothered to tell us. Some send us flowers at Christmas, and others write a 30-page handwritten letter to our MP and the chief exec complaining. And they're often the people who will turn up to patient groups because they want to help. Breast screening isn't patients, it's the general public. How do you target the general public? How do you find 50 to 70-year-old women and ask them what they think? As a patient, I'm incredibly interested in my own health and my own data. I want to know what's going on. But before I got cancer, I never checked my own breasts. I was invincible. I'm not going to get cancer. Do the public really care about their health? So we did a group at a hospital, just asking people at a hospital awareness day what they thought about AI. 2/3 of people thought, yeah, it's fine. 1/3 of people weren't actually bothered. Until you start asking the general public, you don't know what they think. And you need to know what they think to help you then sell it to them. What I want to end on is the 3 points for anyone developing a digital healthcare startup. The first thing you have to do is do no harm. You have to make sure that what you're offering is as good as the gold standard. For breast screening apps, you don't want people to not come because they're scared it doesn't work. You want them to trust the data, know it's private, and know it's protected. The second thing is huge, it's quality. And as a doctor to me, as a surgeon, quality was providing safe operations, pretty pictures, patients being pleased, evidence-based care. But the third thing is the patient experience. It's very hard to measure, it's hard to prove you're changing it, and there's no money in it. The NHS isn't going to give you money if your patients are happy. They want you to get out of hospital quicker. But it's the most important thing. How does your app work? What is the clickability like? I have a patient portal where all my results go in, but they don't notify me to say there's a letter telling me my appointment's there, so I don't check. So it's no use to me. The final thing, though, is giving something back. A lot of the general public think that all these startup companies are just doing it to make a quick buck. You're doing it to make money, you're jumping on the bandwagon. Why are you doing it for me? Are you really doing it to help patients? And Chiron are now working at sponsoring a PhD student and doing health promotion events because it is all about the health of the public. That is who you're trying to help with digital healthcare. And why is that important? Because you will all be a patient yourself one day. Thank you.
Thank you very much, Liz. I think we have time for 1 or 2 questions, so please raise your hand. One here at the front.
Thanks very much for that. That was wonderful. So you said that you work kind of with Chiron and you're there to hold them to account, and lots of discussion in the past has been around, how do we make these kind of slightly opaque companies transparent in different ways. So can I ask kind of how that really manifests? Like, how do you really hold them to account, and how do you really quiz them? And maybe even what your arrangement with Chiron is, because it would be great to see more startups having someone like you on board.
So every stage of development, they talk to me and say, firstly, as a doctor and a patient, is this what people need? How do we explain it to them? I have meetings with all the different hospital collaborations. They've got the test beds in to help them talk to the general public to make sure they're targeting the right groups. We're using a lot of social media, but that's often very white and middle class, and it's saying, actually, you need to target people of every ethnic diversity and cultures, people who don't speak English, and making them realize they're a company run mainly by computer geeks running the program, and they don't know what it's like in the real world. So I go and talk to them about what breast cancer is, so they have an understanding of what patients need. And every time they move to the next forward step of their trial and research, I'm saying, right, what do the patients think? How are we asking patients? How do we know this is good, this is working to get their respect? As well as making sure there's the evidence behind it. And they can tell me my data is safe, it's not going to be stored and given to someone, it's not going to be sold. The things that they wouldn't consider. But it's a new role, there's nothing out there like it. They asked me to write my own job plan as a patient advocate, so we're kind of finding the way. But I think there are so few companies with patients on board.
I think we have time for one more. There. If we can just keep it brief, that would be
And
excellent.
I'll give a quick answer.
Yeah, exactly.
Hello, Ben Heather, HSJ. You talked about some AI products being better than others. There's a lot in the NHS currently that is being offered as part of the service. From a patient perspective, and also I guess from a clinical perspective, how well do you think the NHS as a whole is at telling patients what they should, marking products that are worth using, that are safe to use, and products that are perhaps not in this space?
It doesn't. As a doctor, I get no training in what apps or digital care are out there, and I don't care because I'm too busy working out what next drug to do. And I didn't realize there was a Macmillan app to help you control symptoms of chemo. I found it on my last day from another friend who's an internet geek and a doctor. Doctors have no idea what patients need because they've never had that illness. And you could get patients to say, right, here is a digital signpost. You've had a heart attack. These are the apps, the forums, the websites. Get someone to do the work. Every hospital website could have a page, right? Heart attacks, diabetes, this is your digital signpost. We don't know what's out there. We don't get trained. Nurses don't have the time to do it. It's patients finding the way and trial and error. And that's where you could use social media and get patients who have those illnesses to say, this works for me, right? Okay, let's tell patients what they need. That's how patients learn. And it's from the bottom up saying, no one told me, why aren't you doing it?
Excellent. So thank you so much, Liz, for sharing your experience. If we can give her a round of applause.